Welcome to RXOOM Patient Health Record System. This patient health record system used for uh, couple of activities, um, including patient appointments, viewing the patient health records, sending the prescriptions, and so on. So I will provide you the demo um, in couple of minutes. So please stand by. So here is a successful login. Once you log in with your credentials, you will be landing on the PHR dashboard. The dashboard will looks like this, where the active patients will be listed in this. You have a filter where you can go through upcoming appointments. You can filter by latest report uploaded. You can look at your incomplete appointment, or you can filter by completed appointment, cancel appointment, or you can look all your patient list. On the left side, you can see there is a menu where you have my profile, where you can set up your profile, pictures, and all other details. Change password, you can personalize it, and then there are some more features which includes my doctors, my staff, my chemist, my diagnostic centers, my clinics, set working hours, set consultation, statement, bills, send invite. We'll walk through some of these features in coming few minutes. So as soon as you log in, you see the active patient list. The active patient list normally are the patients who have an upcoming appointments, or or their reports or some activity happen on that particular patient, like reports are uploaded recently or their appointment is coming up. So here if you see, there is upcoming appointment at 6th April, reports uploaded, check patient EMR. So there are reports uploaded for this patient. The patient name is Anita Nimbalkar, 54 year, and the patient EMR is been uploaded, patient records has been uploaded. Um, if you are wanted to see very specific patient, you can search by the name or phone number and particular patient. You can search here for to look at your previous patient list. Also, if you want to register the new patient on the system, you just go and click here and just put some more details about the patient, first name, last name, gender, and all that. Patient get registered. As soon as patient get registered, uh, the registration email, successful registration email, go to the patient, where patient can look at their account and look at the reports, and they can set up the appointment from their account. um, so I'll cancel this for now. So this is how you go and go ahead and uh, upload the reports, add the new patients. uh, Here are you can the way you can see the new the previously added patient. Let's say I wanted to see what's going with this patient. um, so I have an option here to begin consultation, view EMR, tracker, and more options. So let's see what is the EMR. So I wanted to see what is the new report coming in for these patients. When I when I click on the reports, here there are multiple options for me where I can click on the report. Let's say I see here there is one report, CPC report is been uploaded for this patient. I go and click here, and I see this is the new report coming in for the patient Anita Nimarkar. Okay. There are a few more tabs here. You can look up, you can start consultation from here, or you can look for the previous consultation from here. If there is any previous consultation, this patient do not have any previous consultation, any previous history to it. So this is a new patient who just uploaded the report. This tab allow you to generate the medical certificates or fitness certificate for the patient. Um, Here is a sample where header and footer that is being selected as a part of the appointment part of setup initial setup where you can set up this header and footer, and this is a common template which you can change if you need to, but this is how you can generate and print or send an email for medical certificates. At the same time, you can generate the fitness certificate in the similar fashion for the patient and send an email. There is a referral. I'll come back to these features later. But here important feature, if you look at it, the consultation, look at the previous consultation, look at the reports, and look at the medical history if it has some medical history, past illness, social habits. So if it is a new patient, it's a doctor responsibility to fill this information, and it gets stored for the lifetime of this patient. There is one more interesting feature here is called the tracker, which shows the trend in the patient, like how the BP over the period, like if he has a 10 appointments taken, how his BP progress last 10 uh, schedule appointment or last 10 months, or how his sugar progressing over the period. So it is a pretty much a tracker of the parameters which we wanted to measure across the over the period of time. And the tracker is very useful function when it comes to tracking the patient trend, in particular like BP, sugar, or any other trend if you wanted to track for this patient over the period. Let's go back to the uh, main dashboard again, where we started here. So for this patient, we have looked at the EMR. There is a tracker we just talked about. There is one more tab which is called the Start Consultation. Start Consultation is basically you start writing the prescription for the patient. As soon as you click on the Start Prescription, here default information comes in. After that, you can fill up this information if you have, and then let's say your diagnosis, the patient diagnosis is fever. You can put a symptoms. Your diagnosis is, let's say, dengue is the diagnosis. You can put diagnosis. You can start writing the medication, like let's say ibuprofen. Um, this is quantity. Then this is a kind of number of days, and if you have a lot of instruction here, so if you take after food, before food, whatever instruction you wanted to give, you can add more. You can add more, and once you're done, okay, you add more medication if you want, like uh, let's say tabicillin. Then, oh, we already talked. I already written about this. You can add more. So this is basically you mm, mm, let's say this 2 days, something like this. Okay, now you have added to medication. So this is done. Then you can start in typing your investigations if you want to write some investigations. Investigations. And you can keep typing investigation. You can have follow-up advice. Please come after a month for testing. Then you can put a follow-up dates if you want to put it, and this is the prescription ready for you. Now you can save this prescription, and once you save this prescription, you can take more action on this prescription, something like okay, sorry. Now once this prescription is ready, you can send this prescription. Either you can print this or send this to the particular patient, like let's say this is the patient email ID. by default email ID will already come to this because it is a part of patient health record system. So default email, or if you want to change, you can change it. So it will go to the patient email ID and the phone number. It will go as a SMS and email. This prescription will be sent as soon as you say sent now. And if you want to take a printout, you just say here print, and it will print. So let's say I'm sending this prescription to patient now. Okay, this prescription has been sent successfully to the patient. And if you see, here is a prescription received for a patient. This is the prescription. As soon as the patient click on this, patient will see this prescription PDF generated for him, and this is prescription received for the received in his email, and he can take it to the pharmacy for further follow up to take a medication or something. So here what we know of for now is how the patient how you can generate the prescription for the patient, um, how you can take the look at the patient health records. If you like to see some other patient health records, look at the some other patient health records here. Let's click on the view EMR. As soon as we click on the view EMR, we can see again uh, consultations, and if you look at this previous consultation, is this Rohit Sharma? The patient has a lot of previous consultation. If you look at this on 23rd March, he has some consultation. This is his prescription. Yeah. Then 20th March, this is PDF. You look at this is prescription. So this patient has a previous records to this. Uh, and Now go back and mm, look at some other features onto this one. I will go to back to the list. Let's say the patient. Here are some more action which I was talking about. More action, like you can send the reminder to the patient for um, appointment reminders. Add reminder saying that select appointment schedule with doctor. Madam Anita Nambaka, and now frequency. Every 2 weeks you get a reminder. So it's date of reminder this frequency here. Once you set this reminder, patient will get an SMS and email for schedule an appointment. This reminder is specifically for the patients who needed to visit a doctor office on frequent basis for follow-up action. So you can just set up an reminders, and patient will get this email reminder automatically, and you don't need to worry about whether patient is followed on correctly or not. So they will look at the reminder, and you can set up the reminder based on the frequency you wanted, the date you wanted to start with, and all that. Okay. So let's say I set up this reminder. So this reminder will automatically send this email on to the patient on just 2 days before, 24 hours before, and something like that. There is one more function here. If you look at it, there is a messaging system where you can start really the messaging with the patient. Hi, Anita, how 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 is your health um, uh, progressing? Progressing. Now you say you let's say you ask this question to patient. The patient will reply back, and this whole thread will continuous, and this full communication will be stored here for a life of this patient on this system. That means you can go back 5 years back, what was your conversation with the patient, and that information is being stored here. And you will have the complete knowledge of the history of the patient communication, the communication between patient and you throughout the life of the patient. Uh, Again, there is a there is one more good function here where you can choose the preferred network. What does it mean is you can have your preferred network of doctor, pharmacist, or labs. and you make your own network. So let's say in this system there are there are this is, let's say, doctor, neurosurgeon. Now these are other doctors who are physicians or gynecologists, and you wanted to be part of this network. You just attach this doctor into your network. So or if there is a new doctor, then you need to add those doctor into this system and make a part of your network. The advantage of having a part of the network is basically you can share the patient health record with those doctors for as a referral point of view. So you can refer the patient um, um, to any of your referral network. So let's say the doctor, you are a neurophysician and you wanted to uh, refer the patient to the neurosurgeon. So the part of neurosurgeon in your referral network, you can add into your network, neurosurgeon into your network, and then send the patient referral to the doctor. The Also, you can share the patient health records to the your referral doctor. That means the patient health records links will be when you send these reports to the other doctor, the referral doctor will excuse me, referral doctor will receive the link where doctor can review the patient reports, and that access of the report will be given for a certain time like 24 hours or a week or month. It is based on you, and after that that report will be no longer available to the accessible to any other your referral doctor. So it is a finite time where you assign you assign the reports, or you allow doctors to view the reports. Um, as I mentioned earlier, this is a completely HIPAA compliance um, patient health record systems. What does it mean is that patient records are always owned by the patient and doctor. So if you are referring the patient to another doctor, you can allow them to view the report for only certain period of time, and after that that uh, link will be deactivated, so that your referral doctor will not be able to see the reports after certain period of time. So yeah, again, as I mentioned, there are few more actions you can take in this. Is um, you can have preferred lab network where you wanted to send the prescription directly, the lab prescription directly to the lab. So you can have the lab diagnostic centers, which is a part of your network, where you, whatever prescription generated here will be sent directly to them by email, and they can upload the report directly into the system, where you get a chance to view the report in on time. And the patient don't need to handhold these reports here and there, and also take a prescription to the given lab. Of course, patient have a choice to go to any of the lab, but this facility is provided, but you can attach some of the labs as a part of your network. Also, you can send the prescription directly to the pharmacist, which are the part of your chemist network. So you can have your own chemist network, you can have your own lab network, you can have your own doctor network, and you can share the prescriptions reports across your network. This is one of the another good feature of this. uh, some of the another handy items here, as I mentioned, these are the doctor network you can make. You can add the staff who can manage your appointments, and you can manage the whole system. You can add the staff and give the access. Um, this we already talk about. You can add your chemist network. You can add your diagnostic sector. You can add your clinic details. You can also set up your working hours. You can set up your consulting hours. All that can be set up here. This is kind of more menu items which can you can generate the bills, you can send the invitation to someone. So these are more handy items to play around, but the most important features of this, I will repeat it again, the most important features to this EMR systems is uh, patient patient health record system, where you can see the patient health record reports, something like this. Um, Again, you can look at the patient history. You can look at the patient trend of the particular trend going on. Sorry. Um, and that's pretty much about this patient health record system. I hope you will enjoy this patient health record system, and keep us posted if you have any further feedback on this patient health record system. Thank you.